Welcome to the press briefing. With us today, Dr. Chang Shukwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. As of last night, the number of new positive cases was 3,164. Through RAT, 4,432 cases. Altogether, we had 7,593 cases. In the fifth wave, altogether, there were some 1.13 million cases, 116,661 through PCR, and some 410,000 cases through RAT. And among the 3,164 PCR positive cases, 495 were found through the Hospital Authority, 532 through the CHP, 2,137 cases detected through private laboratories. Of the cases yesterday, 1,008 cases were subject to rapid genome tests. The L452R variant was not found. 970 cases tested negative to L452R. That is, they were suspected to be Omicron cases. 38 were pending or the viral load was too low. Among the cases yesterday, 2 were imported. Both patients arrived in Hong Kong via flight QR818. Yesterday, we did not receive new positive cases from residential care homes. For death cases, another 194 cases were reported by the HA in the fifth wave. Altogether, there were 7,309 cases. 47 were reported through forensic doctors. Yesterday, we received 2 deaths reported by the TMHK Medical Center. Both cases were patients referred by public hospitals. Both were residents in residential care homes, and both were unvaccinated. One was an 89-year-old male with chronic illnesses. On March the 5th, he tested positive through RAT. He was transferred to the TMHK Medical Center on March the 16th, and on the 27th, his test result was negative. He died of bacterial pneumonia. The clinical conclusion was that this case was not directly related to COVID-19. Another patient was a 106-year-old female with chronic illnesses, and she had lung failure, and on March the 15th, she tested positive through a PCR test. She was transferred to the CHK Medical Center on March the 21st, and subsequently she passed away. And according to classification by the WHO, her death might be related to COVID-19. The total number of deaths so far stand at 7,358 cases, including the cases I just mentioned. 56% were residents from residential care homes aged 11 months to 112 years old. The median was 86-year-old. 8 were children aged under 18. 96% of the deaths were patients above the age of 60. The crude death rate was 0.65%. The unvaccinated made up, the rate was 3.5%. Those who received 1 shot, the death rate reduced by 3.5 times at 0.87%. Those who received 2 shots, death rate was 0.13%, or a 23-time reduction. Those who received 3 shots, death rate was 0.03%, or a reduction of more than 100 times. That's all for my report. I will now invite Dr. Ho to brief us on the situation at DHA. Good afternoon. 10,905 patients are currently staying in our public hospitals: North Atlanta Hospital, Hong Kong Infection Control Center, HA Infectious Disease Center, and the Asia World Expo COVID Treatment Facility. As of last night, 26 patients were in critical condition, 50 were in serious condition, 97 patients in critical condition were staying in ICUs. As of midnight, over the past 24 hours, 109 patients who tested positive passed away, including 78 males and 51 females aged 50 to 106-year-old. Of the patients who passed away yesterday, 59 came from residential care homes, 83 did not have any vaccination record, 28 received 1 dose, 18 received 2 doses. 123 were elderly people aged above 65. 2 patients were relatively young. 1 was a 50-year-old male. He had chronic illnesses. He had brain degeneration, and another patient was a 57-year-old male, again with chronic illnesses. He had to take steroids and blood thinners, and he also had a history of coronary diseases. Both had chronic conditions, and so the likelihood of contracting serious complications or death would increase. And due to a backlog of data, from 26th to 27th of March, 20 patients passed away, including 13 males and 7 females aged 43 to 94 years old. Over the past day, 1,258 patients were discharged, and another 20 or so patients were detected through in-hospital screening. Some 20 patients in the same wards were classified as close contacts. In terms of staff members, so far, 20,961 staff members of the HA contracted COVID so far. Some 17,000 staff have returned to their jobs. In terms of the administration of COVID-19 drugs by the HA, as of March the 28th, more than 20,100 patients were prescribed with oral antivirals at public hospitals. When medications were prescribed, our colleagues would consider whether these drugs would benefit the patients and whether the patients were fit to receive the drugs. So long as they were fit to receive the drugs would be administered. Since February the 23rd, we started providing the first oral antiviral, which was molnupiravir. At that time, a number of patients were hospitalized, so in the first stage, we prescribed the oral antivirals to patients in hospitals, and about a week later, on March the 4th, we started prescribing these medications to those in residential care homes, and on March the 16th, we started prescribing another oral antiviral, which was Paxlovid.
And subsequently, these 2 oral medications are available in our community centers, in the COVID centers and designated clinics. They're also available in old age centers. They can receive this prescription medicine. So aside from government hospitals, we're also working with private hospitals Starting from 25th of February, there was an arrangement for private hospitals, and now in 13 private hospitals in Hong Kong, we have this new medication, including the 2 new oral medication. On 21st of March, we have simplified the prescription process, so they don't have to apply individually. We can provide a batch in one go, and if necessary, the private sector can continue to receive the supply from the government. So in total, we have provided more than 400 doses for private clinics and hospitals. Now, regarding private doctors, we would like you to understand that the prescriptions by private doctors, they are not vetted by the hospital authority. We understand that the government is in discussion with the industry. When more private doctors can prescribe new oral medication, there is an advantage for patients. So if there is any progress, we're very happy to facilitate that, and we are willing to cooperate. Lastly, we also want to urge patients that these 2 COVID medications are proven effective. So if patients need these medications, they should go visit the relevant clinics, and if it is suitable, we will arrange for the prescription. And if they have a severe case, the patients should go visit the accident emergency centers. The queues have been streamlined now, and we hope that we can prevent death and serious cases. That would conclude the report. So before you raise questions, please identify your media outlet. Now TV, regarding the 106-year-old female admitted to CU Hospital, could you explain why their situation deteriorated and ultimately died? When their situation deteriorated, why weren't they transferred to a different hospital? And I'm also aware that the TCM doctors from the mainland have arrived in Hong Kong. When will they serve in AWE? And could you disclose a bit more, how will they cooperate? So if patients are on Western medication, how will you coordinate the TCM prescriptions? And lastly, the Social Welfare Department temporary facility, could you explain the procedure? If there are cases at the elderly homes, can they contact SWD directly? And if we have mild cases, do they need to notify the health department first, or will they be sent directly to the temporary centers? Let me respond first. The CU hospital case, the 106-year-old patient, I note that that patient had multiple chronic diseases. They had bloody stool, they were elderly, and they weren't doing invasive procedures. So on 28th of March, the patient deceased. Regarding the temporary centers, the holding centers, we hope that when there are confirmed patients, they can leave the elderly home and stay at the holding centers. So the holding centers are one of those locations. So when we receive requests and reports from SWD, we will arrange for speedy referral. I'll respond to the TCM question. We have to thank the mainland experts for serving in Hong Kong. We believe that their professional expertise and experience during COVID can help us enhance treatment for COVID patients. And we also believe that we can reduce the number of serious cases and number of deaths. They can also help with the recovery of patients. The expert that arrived in Hong Kong today, first of all, will start his work at the TCM Center. They will share their valuable experience and TCM expertise. Now, previously, a group of TCM doctors had arrived in Hong Kong. They are working in our COVID centers and providing service. So they participate directly, and every day they visit the wards, they diagnose patients. They also work with TCM Western doctors. They will diagnose patients and discuss the treatment. Currently, we are aware that there are a lot of elderly in our centers, and we see that TCM is particularly effective for patients with chronic diseases, especially when a lot of elderly are infected. They already have chronic diseases, so TCM, there are overall many positive benefits when they receive TCM treatment. So we would like to see Western doctors and TCM doctors cooperate and enhance our service. Regarding the oral medication, I mentioned just now that in our community centers, our designated clinics, and elderly homes, we have prescribed the oral medication. Next question. I have two questions. In QE on the 13th of March, it was a designated hospital to receive COVID patients. So the number of serious cases reduced by a third, and the number of deaths also came down. So will the government increase more designated hospitals and have triage management in the CU hospital? For every 5 recovered patients, only one person will have hepatitis-like symptoms. So what are the risks? And aside from that, for known COVID symptoms and side effects, what kind of treatment do we have for the known side effects? And can you explain the importance of vaccinations? You can answer in Cantonese. Earlier, QE hospital had been converted to a designated hospital to receive COVID patients. So aside from QE, we have other designated hospitals that have been converted to deal with COVID. They are in our cluster network. We also have taken 50% of A&E beds and converted them to receive COVID patients. So that has increased our capacity. We have the triage in place, and we hope that we can reduce the number of serious cases and deaths, and we can reduce the number of infections. So capacity has increased. Patients waiting in A&E, that has improved significantly. So we now have more beds than patients, and for serious cases, and we will arrange for speedy admission. Regarding COVID symptoms and experience, and regarding long COVID symptoms, our experts are looking into that. So regarding your question, we will be investigating that. So I would like to repeat once again, for those who have not been vaccinated, please get vaccinated, because prevention is better than treatment. Even though we have oral medication, we all know that the vaccine has been proven around the globe. It can reduce death rate and serious cases. So those who have not been vaccinated should get vaccinated. Those who have the first, second dose should arrange for the third dose.
Next, the gentleman on the second row in the back, please. Good afternoon, I'm from Cable TV. In terms of the overall trend of the pandemic, compared with 7 days ago that the caseload has dropped by about half. So what is the CHP's take on the pandemic? Earlier, you indicated that you would make observations for 2 days, and now the caseload has declined for about half. Do you think that the pandemic has stabilized, and would the declining trend continue ahead of the Easter holidays and Qingming Festival when people go grave sweeping? Would there be a rebound in terms of the calculation of the death rate? Some experts suggested an antibody test towards the end of the pandemic to determine how many people contracted COVID. Do you find this approach appropriate, and would the execution be challenging? Chinese medicine experts from the mainland arrived in Hong Kong. The 7 experts would make inspections or visits at the makeshift hospitals and facilities. Would they engage in frontline work? And in terms of the use of Chinese medicine, how do you think it can contribute, and are there benefits to be had compared with traditional treatment? The overall numbers have been in decline. As to whether the decline will continue or the trend or caseload will continue to plateau, it's a rather difficult call right now. The trend of the pandemic is, of course, closely related to the flow of people, and with more people going about, we could see a rebound. So we urge people to refrain from going to crowded places in the coming holidays and maintain personal hygiene. I'm not an expert in terms of the antibody testing, but as far as I know, after vaccination, the antibody levels would go up, and the same goes if you have contracted COVID-19. So I'm not sure whether the results could distinguish between recovered COVID patients and those who had been vaccinated. During the pandemic, DHA has adopted Chinese medicine in different areas. Apart from the CM clinics in all 18 districts, we have provided remote diagnosis services. Meanwhile, we are also providing inpatient Chinese medicine services. Back in January last year, at community treatment facilities and the North Lantau Hospital, Chinese medicine treatment services have been provided, and integrated Chinese medicine, Chinese Western medicine has been adopted. Currently at the Asia World Expo, we have a lot of elderly patients, and very often they have chronic illnesses. We saw that Chinese medicine has obvious benefits for some of these patients, and they can help improve the well-being of such patients. We hope we can continue to maximize the benefits under the integrated Chinese Western medicine approach. Next question, please. I'm from Hong Kong One. For the number of people reviewed under the RAT declaration system, how many of them tested negative, and how many were sent to isolation facilities? How long do they have to stay here, and what are the procedures they have to undergo? A retest will be conducted at the isolation facility. That is, they will be tested twice. If both results are negative, we would look into the reasons. If they were not confirmed cases, the isolation order would be suspended. Next question, please. The lady on the last row, please. Good afternoon. This is RTHK. The number of positive cases have been in decline in recent days. So is this a reason for optimism? On April the 21st, some anti-epidemic measures will be gradually measured, will be relaxed, and is it likely that more measures will be relaxed? At public hospitals, what is the occupancy rate of beds? The occupancy rates have declined compared with the peak, but still more than 7,000 people declared their positive results. I think 7,000 cases per day is still a very high level. Even though the pandemic has somewhat eased, it could rebound anytime. This would be related to the flow of people and whether people continue to stay vigilant. We hope that the decline will continue and that the number of cases would remain low. I would provide the figures in a moment. Next question, please. I'm from Phoenix TV. For the Chinese medicine from the mainland who arrived in Hong Kong today, for the HA, the mainland has achieved positive results in terms of integrated Chinese Western medicine collaboration, and would this contribute to the application in Hong Kong? Would the HA expand the scope of specific or specified clinics outside of the Asia World Expo? For the 2 cases referred by the TMHK Medical Center, they passed away. What was the nature of such cases? If more deaths are observed, would you adjust the criteria for referral? That is, those in less severe conditions would be referred to private hospitals. As far as I know, the 2 deaths involved older patients, and they had underlying chronic illnesses. According to classification by the WHO, the 106-year-old female might have died of COVID. The other died of another reason, that was pneumonia, but it happened that he just recovered from COVID-19. Thank you for your question. I would address your question in Cantonese. We thank the mainland Chinese medicine support team for offering their help. We believe their expertise and knowledge can help reinforce our services. Apart from the Chinese medicine clinics in 18 districts, we have provided remote consultation services, and we have also provided inpatient Chinese medicine services. We hope to expand the scope of application going forward, and the HA will continue to monitor the situation and address patients' needs. Next question. I'm from Orange News. Yesterday, there were 459 buildings with new cases. Of the 6,000-odd cases, Yuen Long had 558 buildings, the most among all districts. So is the pandemic facing the most serious pandemic so far compared with other districts, and what measures should residents observe? You may refer to our daily figures online, and you could see a breakdown in 18 districts. Basically, we have seen more cases in some districts, but given the heavy flow of people in Hong Kong, very often people would work in different districts, so I think everyone should stay on guard.
First of all, the CU Hospital death case, the 106-year-old person, So, were they a mild case? Could you tell us since which day did they have serious symptoms and on which day did they decease? And the medication loaned to private hospitals, you said there were only some 400 cases, 400 plus cases. Why is the figure so low? Is it because the private hospitals don't ask for too much medication, or is there a time lag in the application process? Regarding the mainland TCM team, so could you give us more details? For example, are they prescribing more medication, or are they just providing a diagnosis? Could you elaborate a bit more? I'm sorry, I don't have the 106-year-old patient's detailed clinical information. I only have some basic information that they are 106 years old, they had a lot of diseases, and they had cancer, they had some renal problems, and there was a bleeding stool, and so on. And they would not have performed in-depth clinical analysis. Regarding the clinical symptoms and changes, I don't have the detailed information, but according to the attending doctors, the patient's death, according to WHO classification, it might have been related to COVID. Now, regarding the private hospital's medication, it depends on the patient's needs, and according to guidelines, the patients who need it will receive medication. So we make arrangements to loan the medication to private hospitals. At the same time, on 21st of March, we have streamlined the process so they can have some stock, and when patients need the medication, they can also loan the medication from us. The TCM teams, they are top professionals. Their expertise is abundant. They also have a lot of COVID experience. First of all, they arrive at AWE. They are stationed at the AWE, and they also attend the TCM clinics in our 18 districts. So TCM, aside from treatments, they also have a rehabilitation advantage. So we would like them to provide opinion in different areas. We would like to expand the coverage of TCM, and we would also like to help patients who need the assistance. We want to fine-tune our treatment. And just now there was a previous question. I need to update you on the number of admissions. We have 11,000 patients in our government hospitals, and the usage rate is quite high because even though we see a drop in the number of infections, but typically patients are admitted for more than a few days, so there is pressure on our system. So as I said previously, 50% of our A&E beds are now allocated for COVID patients. So we are keeping a close eye on the demand situation. Ming Pao, the 106-year-old CU case, do you have their vaccination records? Were they prescribed the oral medication? And when they left the government hospital, what was their situation? So could you also explain why their death might be related to COVID? Did they have any other symptoms that might be linked to COVID? Now, regarding the oral medication, so if residential care home patients, elderly, if they are sent to holding centers, can they still receive oral medication? And lastly, noon today in Kennedy Town, there was an infected person who fainted and then passed away. Do you have any details? When did he do you have his clinical history? Had he been prescribed medication and so on? The CU Medical Center, that patient did not receive vaccination. How would they be classified, whether they died of COVID or not? It is the WHO has some detailed guidelines on the classification of death, and the clinical doctor will make a decision. Now, typically, if there are other reasons to explain the death, and COVID might not be that significant in this case, and therefore would not be classified as a death related to COVID. If there were direct or indirect causes, they would classify accordingly. Now, I don't have information regarding the Kennedy Town case that you mentioned. Just now, you referred to the Kennedy Town. That would be included in tomorrow's report. So let me just briefly elaborate. She was a 25-year-old female. She had a blood problem. Her relatives found her unconscious, and she was sent to A&E. And she had 2 vaccinations. So tomorrow, when I have more details, I can report. The oral medication is available in the community centers, designated clinics, government hospitals, and old age homes. Now, if there are special circumstances, we can monitor the situation to see how we can help the different needs. AM 730, you mentioned the statistics of oral medication. Could you tell us how many prescriptions were made? You mentioned that the frontline staff, they will consider the patient's suitability. So is there an age guideline that it's only prescribed to those 60 or above? Have you relaxed that requirement? So regarding the CU case, was it a mild case, and then ultimately when the patient died, did they deteriorate subsequently, or was there a misjudgment at the government hospital? You also talked about the RAT. Could you elaborate on that? And you said there was a case that is lagging behind, and could you give us more details on that? I know that currently there are less than 100 cases that are being reviewed the second time. They might have been negative on 2 occasions. The oral medication, we have not classified where and how many we have prescribed. It depends on the patient's need and whether they are suitable. If they meet our criteria, we will prescribe them. So we will keep an eye on the situation, and currently we are abiding by the previous guidelines. I mentioned that there are some figures lagging behind. One of them is a male, 43 years old, and he has chronic diseases, diabetes, hypertension. He also had the graft surgery, and there's weakness on his left side, and his situation, he had suffered a stroke, but at the same time, there was a brain hemorrhage. We did a scan and found a brain hemorrhage. At the same time, we also found that he was COVID positive. So our experts will look into the case, and it seems that the brain hemorrhage was the cause of death. And the second case was a male, 49 years old. This male had been prescribed, had abused many medication or many drugs, He also suffered from delusions, and when he was admitted, we found that he had high blood pressure and he had abused many drugs. So it seems that he had abused too many psychotropic drugs, and during the diagnosis, he was also found to be COVID positive, and he died very quickly. So it seems that it was related to his drug abuse situation.
The speaker is not coming through the microphone. I do not have details about these cases, but as Dr. Chuang suggested, they were elderly people with multiple chronic conditions. So apparently that was why they passed away. Next question, please.
Do you notice an increase in octopus travel index in these 2 weeks, and by how much? And we also noticed that in yesterday's update, there was an additional death of a child. Why is it not mentioned today, and can you provide more details on the case? The child case, I think it's younger than 3 years old. And one of our readers' grandma is infected with COVID and currently being treated in a public hospital, and things are not looking good right now. Her families were once infected and recovered, but they were still prevented by the hospital from visiting her. Will the government change the relevant policies to allow family members who have recovered from the virus to visit dying patients? Thank you.
Can you repeat the first question, please?
Is there an increase in octopus travel index in these 2 weeks, and by how much?
I don't have the exact data, but I understand there has been an increase recently.
The pediatric cases you have mentioned, I don't have that information on hand. I will prepare to come and give more information to you tomorrow. And then for confirmed pediatric cases, in general, it's our principle for family and for child policy to allow the carer or parents to stay with the confirmed kids. So in case the confirmed the parents are also confirmed, we'll try our best to arrange them to stay together as long as the operational and room available. In case the parents are negative, and then after explanation of the risk of infection control, and with the permission granted by a CHP, and then we will try to also allow they stay together. But in case the situation of the bed occupancy is really very high, like in the peak of COVID fifth wave, and then we will try to arrange the conversation or telephone update to parents so that let them know the latest situation of the child. Concerning, we understand because the COVID situation is still heavy. So at the moment, we for those patients is nearly the end of their life, will arrange a special compassionate visit so that the family can stay with the last moment of the patient. These procedures is still undergoing in the process.
冇其他提問，今日記者會完結啦，多謝大家。
This is the end of the press briefing. Thank you.